Age-related macular degeneration, or AMD, is non-specific changes that are often seen with aging, and these occur in the very central part of the retina, which is called the macula. And this part of the retina is important for your central vision. For example, the vision you use for reading or looking somebody in the eye, they start to notice distortion. Macular degeneration can be broadly thought of as two categories: dry macular degeneration and wet macular degeneration. Dry macular degeneration is about 90% of cases and generally doesn't cause a large decrease in vision. So macular degeneration can actually be asymptomatic, where patients may not notice any changes. And this is why it's important to have regular dilated eye exams with a professional eye care provider. It's important because the dry macular degeneration is the type of macular degeneration that generally causes very few problems. However, if abnormal blood vessels start to develop in this area, you can have leakage of these blood vessels, which starts to cause fluid underneath the retina and can distort your vision. If you've converted to wet macular degeneration and it goes unnoticed, you could have permanent scarring changes in the center of the vision that will leave you with irreversible blindness in the center of your vision. Again, patients will generally maintain very good peripheral vision throughout their life, so they're able to navigate through doorways and still get around, but they aren't able to read very well and they're no longer able to drive. There are several risk factors for the development of macular degeneration. One of them is aging. Just the process of aging makes people more at risk. The second thing is tobacco use or smoking. We know that patients that are smokers are much higher risk for developing macular degeneration. The final thing is we do know that family history plays some role in the development of macular degeneration. So macular degeneration isn't necessarily preventable, but there are things that we know that can decrease your risk of developing AMD. This includes maintaining a healthy lifestyle, making sure you eat well and get plenty of exercise, and also not smoking. The therapy for wet macular degeneration includes injections into the eye itself. And these sound really scary, but patients tolerate them very well, and they have dramatically decreased the incidence of blindness due to macular degeneration. So they've really been kind of a miracle drug in the past 10 to 15 years since their development.